So today we'll be talking all about cervical cancer. So cervical cancer is a growth of cells that starts in the cervix, and the cervix is the lower part of the uterus that connects the vagina. There are various strains of the human papilloma virus called HPV that plays a role in causing most cervical cancers. So HPV is a very common infection that's passed through sexual contact. When you are exposed to HPV, the body's immune system typically prevents the virus from doing any harm by just clearing it out. However, in a small percentage of people, the virus survives for years, and this contributes to the process that causes some cervical cells to become cancer cells. You can reduce the risk of developing this by having screening tests and receiving the HPV vaccine. It's important to note that when cervical cancer starts to grow, you might not have any symptoms at all. And as it grows bigger, the cancer might start having signs and symptoms where you can have vaginal bleeding after intercourse, between periods, or after menopause. You can have menstrual bleeding that is heavier and lasts longer than usual. You can have a watery, bloody vaginal discharge that may be heavy and have a foul odor, or you can have pelvic pain or pain during intercourse. You should see your doctor if you have any of the symptoms above that may worries you. It's important to also know that there are some persons who are more at risk for getting cervical cancers, and this is persons who smoke, because when HPV infection happens in people who smoke, the infection tends to last longer and are less likely to go away. If you have an increasing number of sexual partners, you are more prone to getting HPV, as to why you are more at risk. If you have early sexual activities when you have sex at an early age, you are more at risk for HPV. Or if you have other sexually transmitted infection like HIV, herpes, chlamydia, gonorrhea, syphilis, you are more at risk for getting cervical cancer. If you have a weakened immune system, you are more at risk for HPV and other health conditions, and so you won't clear the virus faster, and you are more at risk for cervical cancer. So to prevent it, you should ask your doctor about the HPV vaccine. Have your routine pap smear tests, because these are tests that detects precancerous cells of the cervix. So medical association suggests that beginning routine pap smear every 3 years at 21 years old. After you get older or you reach the menopause, it's recommended to do it every year. It's also important to practice safe sex, and if you have not started smoking, do not start, and if you are a smoker, please stop. So as regards to diagnosis, say for instance you did a pap smear that shows some abnormal cells. Your doctor might recommend a colposcopy exam, and we can do what we call a punch biopsy, which basically uses a sharp tool to pinch off small samples of the cervical tissues, or an endocervical curettage, which is an instrument with like a spoon-shaped instrument, or what we call a curette, or a thin brush to scrape tissue samples from the cervix. Then we send these things to the lab to be tested to see if they are cancer cells. The treatment depends on several factors, such as the stage of the cancer, and it can include surgery, radiation, chemotherapy, or even a combination of all three tests. So as regards to getting surgery, these are for small cancers that have not gone beyond the cervix, and what they do is just cut away the cancer cells only. You can also have surgery to remove the cervix, or what we call a tracheolectomy. Or you can have surgery to remove the cervix, the womb, or the uterus, and what we call a hysterectomy. You can also have radiation therapy, which uses powerful radiation or energy beams to kill the cancer cells. You can also get chemotherapy, which uses medicines to kill the cancer cells. Or what we call targeted therapy, which uses medicine that attacks specific chemicals in the cancer cells. There's also immunotherapy, which is a treatment in medicine that helps your immune system to kill these cancer cells. And lastly, there's what we call palliative care. And this is a special type of healthcare that helps you feel better when you have a serious illness. If you have the cancer, palliative care can help you relieve pain and other symptoms, and this is typically used when the cancer has spread to other areas of the body and there is no longer any cure.